Thank you. Next question, Mr. Secretary. Historically, decisions about the safety and efficacy of drugs have been left to the FDA. Yet in your tenure, HHS seems to have gone the opposite direction by significantly limiting the use of FDA-approved drug that could potentially help millions of Alzheimer's patients in Medicare's national coverage determination, and again through repealing the MCIT or the Medicare coverage of innovation technology rule, which further limits the FDA-approved products. Why do you seem intent, Mr. Secretary, on adding an additional layer of red tape around your agencies? If that's not the case, please tell me. I think it undermines each other in the eyes of the public, especially with treatments and devices that may help alleviate suffering for patients. And of course, this is a very important issue. I have many seniors in my district, as most do, that have been inflicted with this terrible disease, Alzheimer's. So if you could answer that question, sir, I'd appreciate it very much.
Thanks for the questions. Let me see if I can try to clarify because it's an important question. There's no doubt that Americans, whether it's because of Alzheimer's or any other illness or condition, are in search of anything that can help their loved ones. I have family that has done the same thing. What we have to remember is that FDA and CMS are two separate agencies with distinct authorities and distinct missions. The FDA is the agency charged with telling us if a particular new drug will be safe and effective. It is CMS's responsibility to tell us if that particular medicine is reasonable and necessary for the diagnosis or treatment of an illness or an injury. Two different entities, two different missions, both based on science and data to give results. And so we cannot confuse what FDA's mission and role is with that of CMS. And that's why you have distinct decision-making. As I've said, the heads of both agencies have come out with a joint statement talking about how it is important, where they're allowed to collaborate and work together so that what we can do is give the American people the best result that we can when it comes to either therapies, drugs, treatments. And I think they're going to work as closely as we can because, as I mentioned, I think to Mr. Upton,
let's make sure that's the case because there are a lot of people with, again, early onset of Alzheimer's that can be helped with this particular drug. So I'd like to see it approved so that Medicare would cover it for our seniors.